Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop show 1085th episode. Let's have the headlines of the day. A recent survey reveals a significant gap in awareness among women about uterine fibroids, with nearly 72% unaware that they are at risk. Given that up to 77% of adult women are likely to develop fibroids at some point in their life. According to new survey data, more than half, that is 53% of women diagnosed with uterine fibroids are offered hysterectomy as the primary treatment option. In contrast, fewer than 1 in 5 were informed about the less invasive alternatives. Mayo Clinic researchers recommended alternatives to hysterectomy for uterine fibroids according to study. Uterine fibroid embolization effectively treats uterine fibroids with fewer post-procedure complications compared to myomectomy, according to new study. A recent research found that 88% of women who underwent uterine artery embolization reported significant improvement in their quality of life 6 months after the procedure. Let's go to the topic of the day. जैसा कि आप सब जानते हैं कि यूट्रस में एक ट्यूमर पाई जाती है जिसका नाम फाइब्रॉइड है, और अल्ट्रासाउंड क्योंकि अब बहुत ज़्यादा होने लगे हैं, तो चाहे सिम्पटम हो या नहीं, फाइब्रॉइड इन पेशेंट्स में पिकअप हो जाता है। तो जब अल्ट्रासाउंड फाइब्रॉइड लिखता है, चाहे वो कितना भी छोटा हो, पेशेंट बहुत वरीड हो जाते हैं, बिकॉज़ उन्हें ट्यूमर समझ के एक ही बात समझ में आती है कि इसमें कैंसर बन सकता है, और वो तुरंत गायनेकोलॉजिस्ट के पास भागते हैं और ज़रा-सी बात पे ज़िद करते हैं कि जी हमारा यूट्रस निकलवा दीजिए, क्योंकि उनको यही डर लगता रहता है कि कहीं कैंसर ना बन जाए। आज पता चला है, आज ही निकाल बाहर करें। यूट्रस जल्दी निकालने से बहुत सारी प्रॉब्लम्स आती हैं, और बिना निकलवाए इसका क्या इलाज है, इसके बारे में आज हमें बताने के लिए आई हैं डॉक्टर टी.एस. उषा किरण. Dr. T.S. Usha Kiran is a highly respected consultant gynecologist at Prime Hospital, Dubai, where she has been serving since 2016 June. She specializes in advanced laparoscopic and hysteroscopic surgeries with a focus on minimally invasive techniques. Renowned for her expertise, she is the first surgeon in the UAE to perform scarless, that is V-nodes, gynecological procedures. After a commitment to innovation and patient care, Dr. Usha Kiran continues to set new benchmarks in women's health. Her work has significantly advanced the field of minimally invasive gynecology in the region. Welcome, ma'am. Welcome to the show, and we are so obliged to have you over.
Thank you very much, Dr. Anita. It's my honor to be here. Thank you.
So, shall we start?
Sure.
Okay. So, what are these uterine fibroids and how common they are?
Okay. So, uterine fibroids, like you yourself mentioned, Dr. Anita, they are tumors of the muscle of the uterus. Okay, uterus has a outer covering called serosa, which is a very thin layer, an inner covering called the endometrium, which is the one which sheds every month and we have periods. And then we have the middle layer, which is the muscle. Now, this muscle is not the same as your biceps muscle, but it is a little different kind of a muscle, but it's at the end of the day, it is still a muscle. Okay. Now, the fibroids are tumors arising out of the uterine muscle. When we say tumor, the word itself, like you said, it kind of generates this big fear. Oh my God, tumor, to cancer hai. Tumor matlab cancer. It's like almost like an equation. So I want to kind of clearly say that these are benign tumors, non-cancerous tumors of the uterus. And the chance of them turning into cancer is extremely rare. अगर फाइब्रॉइड निकालनी है किसी के, not because of the scare of cancer we are removing. There are various other reasons when the fibroid needs to be treated or removed or whatever. But cancer is not one of the reasons. Yes, in extremely rare circumstances, in the last, what I've been in this specialty for almost 30 odd years now, I probably have seen 3 fibroids turning into cancer, 3 or 4 maximum. and I see innumerable number of fibroids. I operate at least about 40 to 50 fibroids every month. So out of this whole 30 years, I've seen about 3 or 4 turning into cancer. So they are non-cancerous tumors of the uterus.
Okay. So, what symptoms do fibroids typically cause, for which a woman would need to go for treatment?
To be honest, fibroids many times are totally asymptomatic. Patients, like you said, nowadays because ultrasound is there and they get detected and the patients come to you. But otherwise, generally patients don't really realize that they have fibroids. The tummy is growing a little bigger, and they think that maybe I'm gaining weight, and it's bloating, this and that. And sometimes I've seen patients coming with almost 20 centimeter fibroid, not realizing they've had fibroids. So generally, they don't cause symptoms. But yes, if there are multiple fibroids, if they are distorting the whole of the uterus, then they can cause pain during periods, heavy periods. And if the small fibroids are actually inside the uterine cavity, which we call them submucosal, they can in fact cause very early symptoms of pain and bleeding. And overall feeling of bloating and distension. Sometimes large fibroids pressing on the bladder and the bowel can cause you pressure symptoms, wanting to go to urinate more often, feeling like you're constipated or something is being pressed on the bowel. So these are some of the symptoms. And of course, if fibroids are in the cavity, sometimes they can end up causing miscarriages. Sometimes it can cause infertility as well. So these are all the things that the patients present with. But majority of them are asymptomatic, and small ones hardly cause any problems.
So, what are the main treatment options available for fibroids?
One of the treatment options is no treatment.
Yes.
Okay,
Yes.
if the fibroids are small, if we scan about 100 women, 50 of them will have fibroids of some kind. So if they're very small fibroids, 1 2 centimeters, they're not causing any symptoms, and they're not like there are only few number of fibroids, not 40 fibroids or anything like that. Then we just tell the patient that no need to treat this. Fine, you have fibroids, we are aware of that. Keep them monitored every 6 monthly or a yearly scan just to see how they're growing. And at some point, when they start growing bigger, yes, you probably will require treatment. So, majority of the times, they don't require treatment. And since this particular session is all about non-surgical options for treatment, so I want to talk a little more on that. So, depending upon the symptoms, is when we advise the patient treatment. So let's say now somebody comes in with heavy bleeding and very painful bleeding. It may be due to fibroids, it may be due to hormonal as well. Even people without fibroids tend to have these period problems. So, in the first instance, I suppose just treat them with medications which can stop bleeding, non hormonal, hormonal. And if that controls their bleeding and they're happy with the results of it, we don't have to go ahead and remove the fibroid again. Then comes the question of there are drugs which have been brought into the market, like the uriprestal acetate, which was used, which was supposed to shrink the fibroid to some extent, but unfortunately there are reports of liver toxicity, so that was withdrawn. Although some places are still using it, but it is banned in majority of the countries. And then we have medications like the GnRH analogs we talk about, which are the injectable medications. They come in oral as well now, although I don't think it's available here in UAE. I don't know about India. So GnRH analogs are basically stopping the ovarian function temporarily, not permanently, temporarily. And they tend to help the fibroids reduce by reducing the estrogen levels in the body, because fibroids tend to get stimulated and grow bigger with the estrogen. So GnRH analogs will tend to shrink the fibroids temporarily. Now, the downside of the GnRH analogs is that when we give them, patients can have a little bit of bone loss. It's a small amount of bone loss, but it's irreversible. So it cannot be used as a long-term management. It's more of a short-term management, controlling symptoms, while we are either waiting for another mode of treatment like uterine artery embolization or surgery or anything, and just managing the symptoms. So
Right.
I will let you ask me more questions rather than me continuing to talk
No, no,
without
no,
interruption.
that is very, very important, because the viewers today will come to know what all is there for them to, Ask the
Yeah.
doctor, okay,
Yeah.
offer me this, instead of
Yeah.
getting scared and running right
Yeah.
forward, take out my uterus. In India,
Yeah.
Supreme Court has given an order that beyond 40 years, you can decide whether you need to take out the uterus or no. But less than 40 years, if
Yeah.
the patient has a serious problem, only then you can take out the uterus. Otherwise, it's
Yeah.
not allowed.
Yeah. Oh,
So that
that's
is
good.
one thing.
I didn't know that. Yeah. Okay.
It's a Supreme Court ruling,
Yeah.
not a law, but yes,
Yeah.
it can get very serious if you don't
Oh,
follow it. Hmm.
okay. Okay. Yeah.
So how do I know? In this from a woman who's viewing right now, and she says, "How do I know if I need to get my fibroids treated, and what would be then the best option for me?"
Okay. So as I said, mentioned earlier, one is to first of all do an ultrasound and if required an MRI to
Hmm.
see how many fibroids you've got and what is
Hmm.
the size of the fibroids, and let your doctor decide whether any treatment is required or not at all. Now, if you have very small fibroids which are not coming into the cavity, not causing you any symptoms, and you've just discovered it just because you had an ultrasound for something else, you might as well not do anything and just wait and watch. Now, if you're having problems with bleeding, yes, we can treat you with medications for the bleeding. If it doesn't get better, then probably we're looking at surgical options, and especially the fibroids which are coming into the cavity. Those ones sometimes don't respond very well to medications and might be better off being removed, which can be done hysteroscopically, which is telescope going through the vagina and cervix, no cuts, nothing. So that's like a simple procedure. That is perfectly fine. But otherwise, the other reason why anybody would require the fibroid removal is, again, if they're thinking of fertility and there is a fibroid sitting inside the cavity, medications might not be the best option in this case. In that case, surgical option is probably the better option. But otherwise, majority of the patients who come in with symptoms of bleeding or pressure symptoms or painful periods, these are sort of the common symptoms. Now, as I mentioned, one of the things is to do with the problems being treated with tranexamic acid, like the ones which stop bleeding, hormonal medications, even a marina coil sometimes can help as well. However, coming to the main thing that we wanted to discuss in this, which is like almost a good match as of a treatment for in terms of non-surgical treatments, is the uterine artery embolization. Now, to just go through what exactly uterine artery embolization is, uterine artery embolization is where the artery, which is the blood vessel going to the uterus, is blocked. Basically, they thread through the artery in the thigh, they pass a catheter, they block the artery in the uterus. So it actually stops the blood supply to the uterus and to all the fibroids that are in the uterus. So over a time period of given about 6 to 8 months time or 9 months time, these fibroids will start shrinking. Now, they don't shrink completely. There is a good 50 to 60% shrinkage expected. But the symptoms, we can get almost 80-90% relief of symptoms. So if somebody is having heavy bleeding or pressure symptoms, which is really making them uncomfortable, they can look forward to a good amount of reduction in the bleeding and good amount of pressure symptom reduction as well. So that is one of the alternatives to surgical treatment.
So, I mean, it would be something like opposite to what cardiologists do when they do angiography and they put
Yeah,
stents to open the vessel. So
yeah.
here
This one
a
we are
blockage
blocking.
is
Yeah.
put. Okay,
Yeah, yeah, you
okay,
you
right.
put it exactly in the right sense. Yeah, I agree. Yeah,
Right.
yeah, yeah,
Okay. So how effective is this treatment in treating fibroids and relieving the symptoms?
yeah. So, like I said, you're looking at heavy periods, painful periods, or pressure symptoms. This can be relieved almost up to 80%. So
Okay.
patients can find a good amount of symptom relief, especially for heavy bleeding.
Okay.
Because with heavy bleeding, the cause might be hormonal, it might be fibroids. But when we do the uterine artery embolization, it is blocking the blood supply to the uterus anyway. It doesn't matter what the cause was, it would still reduce the amount of bleeding. So that way, it really works well. Now, in terms of very large fibroids, it may not work very well, because sometimes if you have a very big uterus, very large fibroid, or too many multiple fibroids, it may not work because it will only shrink to some extent and might not be able to
Not
shrink
beyond
completely
that.
because
Yes.
the shrinkage is only about 50 to 60%. So you can imagine if you have a 25 centimeter fibroid, it
Yes.
still is going to be 10 centimeter by the end of it. So we may not get good symptom relief. But if you have a 5 centimeter fibroid, it can get down to 2.5 centimeter, which is really small. So that's the advantage of uterine artery embolization.
Right, right. So, what are the benefits of choosing this procedure over getting your uterus out or getting the fibroids
Yeah,
out of your body?
yeah. Now, since you mentioned about the removal of the uterus, hysterectomy especially, I want to say that I do agree that a lot of people get advised to remove the uterus. Oh, you have fibroids, remove the uterus. Now, before removing the uterus, even as a surgical option, you can still think of removing only the fibroids. Yes, if somebody is over 40 plus and if they have had already finished their childbearing, that's probably the best option for them rather than go picking up the fibroids. But even then, if there's a single fibroid, you can just remove the fibroid and leave the uterus there. But yes, if there are multiple fibroids above 40, already finished childbearing, yes, that might be a good and a permanent solution to the problem. But however, if they are in their 30s, 35, even if they have finished their childbirth, doing a hysterectomy or removal of the uterus is really not the best option. And you've rightfully said that the Supreme Court is bringing an order for this reason. Um, Now, I think the concept comes from the times where when I used to do I was doing my post graduation. That's almost 30 years back. Um, Anybody who came in to the college, I mean, I was in Grand Medical College, Mumbai. Anybody came in with bleeding, fibroid, what not, you would say that, okay, fine, they're 35, 34 years, hysterectomy. It was almost like that was the first and the last method of treatment for them. And the patients would also not question because they were looking at, we have come from the village and we can't come back for repeated treatment. We don't want to buy medications. So there was a lot of social aspect as well where they wanted a treatment done, a final treatment done, want to go back home and get on with their lives. Maybe it was still appropriate for that era, but now we have women who can afford to take the treatment, who have the knowledge and who can still manage life with all these problems with treatments. So they don't have to get their uterus removed to live a normal life. In fact, it is a disadvantage. You get your uterus removed and then you're left with other problems with the uterus removal. So hysterectomy definitely is not the first option. That's almost the last option we're looking at. In some cases, yes, myomectomy might be a better option. As I said, large fibroids, too many fibroids, those kind of things. But if you have single fibroids, even multiple fibroids, not too big, then uterine artery embolization, especially if you're having problems with bleeding, will control the bleeding to a large extent. So uterine artery embolization is a good alternative to these patients. However, what we have got to keep in mind is that uterine artery embolization, although is a safe procedure and can be advised in majority of the women, if somebody is looking at childbearing in future, this might not be the right option. So avoiding surgery is one thing, but at the same time, keeping the fertility preserved is also the most important thing for them. There are reports of pregnancy even after uterine artery embolization. So if you already are treating somebody who's already finished childbearing, like two children, and they don't really, it doesn't matter to them whether they get pregnant or not, you probably can say, okay, go ahead with the uterine artery embolization. But if somebody is nulliparous, no pregnancy at all, and they're seriously looking at pregnancy in future, uterine artery embolization is not for them because the risk of miscarriage increases because we are altering the blood supply to the uterus, and also the fertility might be compromised. So apart from people who are looking at conserving fertility, rest of the people, yes, it can be a very good option because you avoid a surgery.
So,
At the
this
end of the
is
day,
one,
surgery comes with risks.
yes. Yes. So, one side effect, long term, you told us. Are there
Yeah.
any short term side effects of doing uterine artery embolization?
Yes, short term side effects are, one is, as I said, it doesn't shrink the fibroids completely. So it shrinks them to 40, 50%, 60%. So if they're very large fibroids, it might not really work very well for you. Two is, it also, the chances of recurrence are still there because the fibroid is not completely gone. So and the body is very good at repairing itself. So you block the blood supply, it finds another way to get the blood supply for the uterus. So eventually it will start functioning, if not 100%, at least 80% to the normal. So the fibroids can restart, growing again. So there is about a 30-40% chance that in the next 5 years or so, they might end up, you might have recurrence. So you'll have to base the treatment on the patient's age, patient's parity, what expectations they have. So if you have a person who's 25, 30-year old who's looking at uterine embolization, you've got to counsel the patient that there is a chance that even if it shrinks now, in the next 10 years you probably might end up coming back to us for fibroid treatment because they will start regrowing. If somebody is around 38, 40, finished childbearing, they're probably the ideal ones. You do the uterine embolization. By the time the fibroid starts regrowing, they probably are reaching menopause, so they may not require another treatment. So
Yes.
it's like a little bit of individualizing the treatment. And the other thing that, although the literature mentions that the fibroid, which got the blood supply gets blocked, so the fibroid almost dies, basically. That's how it shrinks. So when that is happening, there is pain, obviously. And literature mentions maybe about 1 or 2 weeks of pain or 3 weeks of pain. But practically speaking, I've had patients who have had uterine artery embolization who have had pain for almost 8 to 9 months, almost a year. And this is obviously I haven't had uterine embolization myself, so what I've heard is only from the patients. So
Mhm.
they say that doctor, the pain is so severe and it keeps coming back and back and back, and it's not like it ends in 1 month. It goes on for about 6 to 9 months. And one of the patients said, if I had ever known that this pain was going to be so much, I would have rather had the surgery and then finished off the pain in 1 month and got back
Mhm.
to work. So counseling is very important. It's not like the pain is anything serious, but if patient is expecting to get better within about a month's time, and then she's left with going back to work with pain, then she would probably then think that, oh, this is not the best of the treatment. No, the treatment is still good, but it's just that we need to counsel them to say that there is a possibility that you might have pain and require painkillers for a little longer time than what you're expecting. I think that's one of the short-term issues with the
Ma-
embolization. Yeah.
So one lady has asked, what
Mm.
is myomectomy and how does it differ from hysterectomy?
Okay, so ectomy is removal, and myoma is fibroid, hystero is uterus. So it is very self-explanatory. So myoma is just removing the fibroid, keeping the uterus. So we make a cut on the uterus, remove the fibroid, and stitch the uterus up. Very, I wouldn't say the same, but very similar to doing a cesarean. You make a cut on the uterus, take the baby out, and stitch the uterus back. So in this case, the baby is actually inside the cavity of the uterus, but this is not in the cavity most of the time. It is actually in the muscle. So we just cut and take the fibroid out and stitch it up. That's myomectomy. So your uterus is completely preserved. So your future function of periods and childbearing, everything is completely preserved. There's absolutely no change in terms of your functioning as a female, this thing. But with hysterectomy, obviously we are removing the uterus, which means that after removal of the uterus, two things happen. No more periods, so you will not get any periods at all. And second is no more childbearing, because you don't have a uterus, you cannot have children. Now, majority of the times, uterus removal does not mean ovarian removal. If you're young, generally ovaries are conserved. Even nowadays, even in 45, 48, we conserve the ovaries because there is some evidence to say the ovaries might actually help in various other functions. So previously, like you were saying, in my postgraduate days, anybody who had a hysterectomy would have a removal of the ovaries as well, because it was kind of believed that what's the point in keeping the ovaries when the uterus is gone? But that concept has changed because ovaries are very essential for your bones and heart and brain and everything. So if you've had a hysterectomy, you don't have children, you don't have periods, but if your ovaries are still there, all your hormonal bodily functions will continue as same as before. Now,
In,
coming
in
to the side effect of the uterine artery embolization, one small
Yeah,
other
yeah.
thing is that when they block the artery to the uterus to reduce the
Yes,
fibroid,
yes,
there is a
yes.
possibility sometimes some of the ovarian vessels can get blocked as well.
Hmm.
So, which is unintended. If that happens, patients can have premature menopause as well. That is one of the complications which we are not planning to do, but it happens unexpectedly. So that is something else also to be kept in mind. Small chances, but yes, it can happen.
Yes, very good. Actually, in India, many a times patients land up in the hands of general surgeons who don't realize how much menopause can affect young women and later on life. So they end up removing the ovaries.
I do
Uh,
agree. Forget
yeah.
about women getting. I once had a surgeon who removed. There was an ovarian cyst in a young girl of 2025 or something. It was long back, and he went in and just removed the whole ovary with the cyst. she
Yes.
was she was such a young girl, so they don't have the concept of how important the ovaries are. I mean,
Ovaries.
forget about general surgeons. For a long time, even we as gynecologists, we did
Also
not
did not
realize
know.
the importance of ovaries. After childbearing, we were like, maybe ovaries and uterus were classified as together and not required, kind of a thing. Only I think in the last 10 to 15 years, this awareness about the function of the ovary and retaining the ovary and the advantages have been kind of impressed upon, and now we are trying to keep them as long as possible.
Right.
Yeah.
So, what are the different types of procedures done to remove the fibroid myomectomy? Like
Okay.
she wants to know the approaches.
Yeah. So it depends on the location of the fibroid, basically. That's the most important. So if the fibroid is inside the cavity, so there are grades of fibroids. You can have the whole fibroid in the cavity, or you can have a part of the fibroid, like at least 70% of the fibroid in the cavity, or you can have more than 50% in the muscle of the uterus. Now, if it is majority of the fibroid, at least the whole fibroid, or at least 70-80% of the fibroid is in the cavity, then it's a very simple procedure. You go in through the telescope, through the vagina, through the cervix, no cuts, nothing, and we remove that. Depending upon the size of the fibroid, it might take half an hour, it might take 1 hour, but usually within half an hour, you should be able to remove these fibroids. Very large ones, I wouldn't go attempting it because it will take a very long time and there are issues of fluid overload and all that. But otherwise, majority of these fibroids, intracavitary fibroids, can be removed with hysteroscope, which is a simple procedure like a day case procedure. They come in the morning, go home in the evening, short general anesthesia. Recovery time is, there's no real downtime for recovery. Most of the times they're like, able to go back to work in a day or two. Although, there might be a little bit of bleeding and pain, but nothing really major. So they should be able to be mobile and do most of the things. Now then comes the laparoscopic procedure, which is the laparoscopic myomectomy, where we put a telescope through the abdomen and then make a cut on the uterus and remove the fibroids. These are for large fibroids which are not in the cavity, majority are in the muscle, or they coming out of the muscle. These kind of fibroids. Now, sometimes there is always this thing about whether to do an open procedure or a laparoscopic myomectomy. If possible, yes, laparoscopy procedure is the best procedure. But you can get a patient who has a huge fibroid, coming up to almost your chest level. And those kind of fibroids, yes, they can still be removed laparoscopically. One is the surgical difficulty of removing them because there is no space to put your telescope and to actually see this fibroid above the level of the fibroid. And two is, even if you remove the fibroid like that, cutting this fibroid into small pieces and taking it out can actually take a long time. That actually can take longer than the surgical time itself. So
Time
in those
itself.
cases, yeah, in those cases, you might be better off actually going in for an open cut and finishing the procedure quicker, and the side effects of anesthesia and all those things, and also multiple fibroids. I've had patients who have had 150 fibroids. Those ones, and especially if there are a lot of small fibroids in laparoscopy, the very small ones cannot be really felt very well. So we might end up leaving them. And then the recurrence is quicker because they already are with so many fibroids. Such patients, open procedure, you can feel the small fibroids with your hand and take out almost, can give them a good 98-99% clearance. So in those cases, you should tend to choose the open procedure. Some of the patients of mine will say, doctor, we really don't want to have an open procedure. Then I tell them, as long as you understand that I'll remove majority of the fibroids, what I can see and feel, but whatever small ones which are remaining there, you might end up coming back with a recurrence. As long as you understand that, I'm quite happy to do the laparoscopic procedure. And then there are some fibroids, I've started removing them through the scarless surgery as well, the
Mhm.
venodes.
We notes, yes.
But yeah, removal of the uterus itself with the fibroid is slightly easier to do in terms of V nodes, rather than just removing the fibroid, because of the location of the fibroid. Sometimes the fibroids could be pushed upwards, pushed sideways. So to get a vision in the scarless surgery from below, some of those fibroids are difficult. Simple ones which are in the posterior wall of the uterus, large fibroids, or not going raising up into the abdomen, those kind of fibroids probably are much easier to remove. But I select those patients very, very carefully, because just because it's a new technique and scarless does not mean that you experiment on everybody and then end up with more
Yes,
complications.
yes, yes, yes.
So sometimes traditional methods will also might be better than trying out a new method. So yes, some of the fibroids can be, I've removed a few fibroids with scarless surgery, but majority of them will end up requiring a laparoscopic surgery.
And what are the chances of fibroids returning after myomectomy? Same as
Yes. So I say this to all my patients. I said, this particular fibroid will not come back. It's not like we have removed a part of the fibroid or remaining bit of the fibroid will regrow. No, this fibroid is not going to come back. But your uterus has a capability to form more fibroids. Now, how soon you will form a fibroid, how many you will form, is something that nobody can actually predict. But based on the number of fibroids the patient already has, there is a way of kind of thinking, yeah, you're more high risk or less high risk. If somebody comes to me with a single fibroid, chances of the person coming back with another fibroid is going to be very rare. Even if they do develop another fibroid, for it to grow big enough for it to require surgery is going to be very, very less. But if somebody comes to me with 50 fibroids, there's no way that that will be the only surgery in their life. They will come back again. So I tell them I
yes,
will do a good job of trying to remove everything, but there is always a chance that your uterus is more prone to, especially the African population. They don't. I've not seen any African patient coming to me with one fibroid. They always have to start with at least
multiple.
10, at least a minimum of 10 they come with, and then it goes from 10 to 20 to 30 to 40, 50, 70, 80, that kind of a thing. So those cases, you cannot guarantee them that they will not have a recurrence. They will have a recurrence, and those are the patients who are good for uterine embolization. If they have
Right.
finished childbearing and if they don't want to remove the uterus, they're still young. In that window period, it's good to keep those fibroids shrinking, and to get away, because when they have that many fibroids, removing just the fibroids is it's a surgery which is not so beautiful. You're making a cut on the uterus in multiple places, because you
Multiple
cannot
places.
make one cut and remove all the fibroids. So you end up almost butchering the uterus and stitching it up. It heals very well. That's a different thing. But
Story.
those patients probably are better off having a uterine embolization as long as they
Right,
finish the childbearing.
right. So this is a lady who's asking, how can I
Mm.
prevent recurrence after surgery?
There is nothing that you or I can do about it, honestly, because fibroids are not forming because of anything. You either have a fibroid genetically, you're predisposed to having a fibroid, so you end up having a fibroid. Yes, the growth of the fibroid can be influenced by certain things, not the actual causing the fibroid. You cannot cause a fibroid in a person who doesn't have tendency, and you cannot prevent it who doesn't have a tendency, who has a tendency. You can keep the growth of the fibroids under control to some extent, not fully, because fibroids grow by estrogen. They're stimulated by estrogen. So if you have a tendency to have fibroids, and if you already have fibroids, you don't want them to grow big. If they're small and you want to keep them down, one of the most important things is to look at how you can reduce your estrogen. I'm not talking about reaching menopause, but obesity, very common these
Yes,
days. So somebody, if you have fibroids and if you're obese, this is one more reason that you need to reduce your weight, because that estrogen from the fat in your body is going to stimulate these fibroids. So exercise and diet play a role in that sense. Not directly, they will not influence the fibroid, but that plays a role. The second thing I tell all my patients is that nowadays the amount of adulteration that happens, we have no idea what we are eating. Absolutely no idea. There is hormones added in the chicken. There is various additives added in the food. So we have no idea all this, how this is making the growth of the fibroids. So the best thing would be to Stick to more vegetarian, stick to more organic food. Make sure that you wash your, whatever food that you're getting, so that you're trying to remove as much as possible your pesticides and all those insecticides and things like that. So yes, all the other things that you would use for health benefits, all the tips for the food and exercise, the same things that you would follow, and that would probably help you keep your fibroids under control, if not completely prevent them.
Right. That was really, really good talk. You have given
Thank
so
you.
many details to our listeners today, our viewers today, and I'm sure
Thank
they're
you.
going to make most of it. Thank you, Dr. T.S. Susha Kiran, for joining us today. Could you show us the certificate, please? This is a very small token of our thanks to you for
Thank you.
sparing your time and telling such
Thank
good
you.
things to our
Thank you
listeners
very
and
much.
viewers. That
It's
will
a
be
pleasure.
all for today. Same here.
Thank you. Thank you.
That
Bye
will
bye.
be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaste.